Hello everyone, I hope you're doing okay as you watch this video. It's all about the good, bad, and the ugly of CBT, or Cognitive Behavioural Therapy for anxiety, a really common tool that a lot of psychologists, other therapists use. I'm sure a lot of you watching have tried it before because it's a go-to method to kind of help you deal with all these unhelpful, unwanted, anxious thoughts that are happening in your mind. So I'm just going to try and demystify it here, go through it and talk about, again, useful principles, the unhelpful bits, maybe the sort of the things that get you off track with it. But again, if you use this, you have success with it, no need to watch this video. If you feel CBT is helping you on the road to recovery, don't watch this video because it's probably going to confuse you. What I recommend, I personally don't recommend anyone uses it. What I recommend is a simple and direct approach to recovery, as I outline in all my videos, by number one, not taking anxiety seriously because we understand what it is. It's simply an overactive flight or fight response, tricking you into getting involved in your thoughts. All we have to do is allow them, go loose, and over time we start to form a new habit, which is a non-anxious habit. So that's the starting point again with this. So that is what I recommend. But again, a lot of people use it. A lot of people get stuck with it. CBT. A lot of people get stuck with CBT. So, and they've asked me to do a video on it. So I am doing this to kind of demystify and explain it. So with all that said, CBT has been very useful in terms of the good bits. It's been great in changing kind of how we think about anxiety. So I think it's actually helped shift the perception that anxiety is some sort of brain disorder, brain dysfunction, to something that we can actually change ourselves. We can change our thought patterns, how we think, in order to recover from anxiety. So it's for the first time, perhaps for a lot of people, it started to empower them to take control of their journey by changing the way they think. So I think it should be applauded for that. I think it's really helped move people away just from the old model of medication is the only thing that that can only help correct some sort of imbalance in the brain. It's helped move the discussions away from that. So from that perspective, I think it has been really useful. So what I'm going to do is just go through what is talked about CBT and unpack it a bit, so if it's useful so you can see, again, what's helpful with it, but what's also potentially pretty unhelpful with it. I'm looking at psychcentral.com. Just to get some latest information on what this website at least is saying about it, because there's some principles around CBT, but in terms of how it's used, it varies, or how different therapists use it with patients, clients varies. So I'm just trying to give you a general overview of it, in terms of what we think about it. So how does cognitive behavioural therapy work, or what's the reasoning behind it? So the goal, at least here on Psych Central, is the goal of CBT is to help you adapt and change your mindset and behaviours by reassessing distorted thought patterns. So it's great. It's going to help you adapt and change your mindset, your approach. That's what I talk about in terms of allowing thoughts, not getting involved in the thought. So the principle of helping someone adapt and change their approach is really useful. Where it starts to get messy is by reassessing distorted thought patterns, and we'll talk a bit more about that, but it's starting to get you involved in these unhelpful thoughts. How does it work? So it works by identifying, tackling and changing unhelpful thinking so that your mindset, behaviors and overall well-being improve with practice. So again, the principle makes sense, but where it starts to go off track, it starts to get you identifying all the unhelpful thoughts, tackling them, maybe going into battle with them, requiring you to change them, almost mechanically change your thought patterns. So the starting point is the foundation by which it starts on is perhaps a little bit weak, because it's already starting with a lack of understanding of what anxiety is and the logical reasons why someone is in the anxiety state. If we know why someone's got into the anxiety state through their sensitized nervous system, the stress they've experienced, it makes sense as to why they're having these unhelpful thoughts. So therefore, we don't really have to try and force change on the thoughts. But that's kind of what CBT is asking you to do. And so what it says in terms of strategies, and this is where it gets, I guess, interesting. It says different strategies that people use for CBT, so for cognitive behavioural therapy. One includes keeping track of your thoughts and reviewing them later. Right. Once you know a thought is anxiety driven, and a lot of the videos I talk about how you identify the anxious thoughts, you know that they're triggered by this overactive flight or fight. That can be any thoughts, really. If you get a surge of adrenaline with any thought, it can become an anxious thought. So if we know that, we don't have to try and keep track of them. I mean, imagine the energy involved in trying to keep track of all the anxious thoughts we have, write them down, and then review them later. You know, what if something bad happens to me today? What if this lump in the throat is something more serious? What if I have a panic attack in public? I mean, imagine writing all those down, having to review them later, and then trying to then be comfortable with them. So again, that's really unhelpful because it's taking these thoughts seriously from the start. It's trying not to, but it's getting you involved in all these hundreds, thousands of thoughts that we all have. We all have hundreds and thousands of thoughts each day. So keeping track of them feels like a lot of effort, and it's a fast track to making you even more mentally fatigued and tired. And we don't want to review them later if we know why they come up in the first place. If we know why they come up, because of sensitization, again, please watch my anxiety cure video series to understand the why. If we know why they come up, we know it's unpleasant but not serious. We don't have to do any of this. We don't have to get involved in these thoughts. Another strategy they talk about here is confronting situations that create anxiety to learn coping mechanisms. Again, it's a good intention behind this one. They want you to keep living your normal life, which I absolutely support and encourage. We want to keep moving forward with life, but we don't want to start confronting situations. So if I've got some social or anxiety when I am in social situations, I don't want to call up my friend and go, right, let's go to a busy cafe so I can confront my anxiety, because again, you're already going into battle with it. With the approach I talk about, we just deal with any thoughts about anxiety as they come up. So if you want to catch up with your friend, you book the coffee with your friend because you want to, not because you want to confront the anxiety. And then if some what ifs, how will I cope? What if I panic? What if I freeze? We practice with those thoughts. We allow those thoughts go loose before we even get close to going to the coffee shop. So you can practice with the anticipation or anxiety naturally as it comes up, because again, they're unpleasant, but they're not serious. If you've got to wait until you go to the coffee shop or the cafe before you practice, you're already building up a lot of expectation. There's a lot of thoughts around it, and you've got to wait until you get into this situation. You don't need to do that with all the work that I talk about. The brain doesn't know whether you're in the situation or you're just worrying about it. And let's face it, a lot of the suffering comes simply because of the anticipation of these so-called big anxiety events. So again, we don't want to get into anything, at least in my view, around confronting situations, battling them, etc. Practicing problem solving with your therapist. Now, look, it doesn't hurt to unpack real life problems with therapists or a support person, a friend, a family member, just to get perspective. But we don't want to start unpacking or debating health anxiety, for example. I'm not going to try and convince my client that they don't have something seriously wrong with their heart or throat or whatever it might be with a health anxiety. Or I don't want to try and debate the fact that they're not going to lose their job tomorrow, even though their body's screaming at them to say they are. So we don't want to dissect or unpack the anxiety problems. We want to allocate them and say that this is just anxiety. It's not the content of the thoughts you're worrying about. You're worrying about the adrenaline that's surging in your body that's tricking you into getting involved in this anxious thought. So we cut it off at the pass, and therefore we don't need to unpack, because otherwise I can try and reassure you till you're blue in the face that you're not going to lose your job tomorrow. But if your body's still screaming at you, you're not going to believe me. So practicing problem solving is a general good coaching tool if you're tired, busy, lots on, but not with really anxious thoughts. That gets you back involved with them. Another strategy they recommend is role playing interactions with others. So again, we don't need to role play because again, we're taking it seriously. We think I've got to confront the situation through a fake role play. You're going to get plenty of opportunities to practice when these anxieties naturally arise in your mind as you go about your day. We practice with those. Yes, you can talk through how you're practicing with someone who understands, like myself, through coaching. That's useful. And we can talk through what you would do with the thoughts as they come up, because often when I'm talking to someone, they're having an anxious thought. So we can practice in the moment with those. So, nothing wrong with talking about it, talking through what your strategy is to allow go loose. That's fine. But we don't want to do to these sort of forced, awkward role plays, particularly with someone who doesn't really understand anxiety in the first place, who doesn't understand sensitization, and is going to get into a bit of a debate, trying to talk about the rational aspects of why you shouldn't be worried about this thing when your body's screaming at you to worry about it. So that's some of the principles they talk about here. Some of the specific different techniques that they recommend on one of their pages in Psych Central. They've got 7 techniques. One of them is cognitive restructuring. So cognitive restructuring is all about changing negative thinking patterns. Sure, that's what we're doing by allowing and going loose. Restructuring your thoughts involves digging deep into what triggers your anxiety, then identifying the negative thoughts that follow. Again, that starts to literally dig deep into your anxiety. We don't need to do that. It's not the content of your thoughts that you're worried about. It's just sensitization because of stress over time. That's a release of adrenaline that's making you feel average, which is tricking you into getting worried about these thoughts. And that's why every person's anxious thoughts are different, because they're not the content of the thoughts. It's just the feeling that comes with it. So we don't need to dig deep. We don't need to explore them. We just need to know that if we're having an anxious response, if we've got symptoms raging, then it's anxiety. That's all it is. It doesn't matter what the content is. It's anxiety, full stop. So we allow those. So we don't need to start to identify all the negative thoughts that follow. We just know it's anxiety. I go loose and allow, as I talk about in other videos. Other things I talk about is trying to convince yourself that you don't need to worry because this situation that you're worried about hasn't happened in the past. They call it worry history outcome. So you end up potentially getting in a debate and yourself, why am I worried about this? Because this hasn't happened before, but it might happen again, your body says. The adrenaline surge says, well, but what if it happens again? So again, if you're doing this without understanding and you're doing this because you're taking anxiety seriously or you don't really understand why you've got it, again, it opens the door for a debate and a battle between, well, this hasn't happened before, then why am I worrying about it? But it feels so real. And so we get into this back and forth, and I don't need to do any of that. We just know any anxious thought, any symptom, any unpleasant thought, fearful thought, go loose and allow the adrenaline, the thoughts to do their thing for as long as they need to, because this is unpleasant, but not serious. So we don't have to do that. Mental spotlight, it's actually saying redirecting your thoughts to something else. So that's fine, but I would call that a natural distraction. We don't want to desperately try and look at our phone and get rid of the thoughts, or go for a walk and get rid of our thoughts. We accept and allow the thoughts because they're not serious. Then go for a walk. Then look at some emails for work. That's fine. So the mental spotlight concept is, again, a good intention, but it's how you do it. That's the key. Worry-free zone is something else they recommend. Give yourself permission to have 10 minutes, 20 minutes of not worrying, where you have a coffee and you don't worry, you go to the gym and you don't worry, you meditate and you don't worry. I mean, look, that's great, right? If you can do it. But the reason why people have anxiety is they can't stop the worry. So look, if that helps you, the concept of a worry-free zone, great. But again, if we are worried, we don't need to dedicate a zone. We just allow, go loose, and know that the energy fueling the thoughts will eventually pass and we'll get relief when it's ready. We can't force this. If it become too rigid, and what if I, put the 10 minutes aside and I can't stop the worrying because I don't really understand sensitization? It's going to get me in a bit of a tangle as well. There's lots of other things on here, like imagining positive imagery. That's nice. But again, if the starting point is you don't understand why your body's surging adrenaline, that's going to make it hard for you to get any benefit from imagining a scene in a park or on a beach. That's nice to do, but we don't do it to get rid of the anxiety, because again, that plays into its hands. So look, the other thing it also talks about is challenging thoughts. So challenging negative thinking. And again, that gets into a battle with it. Oh, this is not going to happen tomorrow. That's not going to happen. Has this happened before? No. We get into this battle, yet our body is still screaming at us to take these thoughts seriously. So it adds more tension to tension. So cognitive behavioural therapy, CBT, it comes from a good place. It's helped shift the needle in terms of how the medical profession at least thinks about anxiety. So, and it's designed to empower you, but there's many forks in the road that get you back into the battle that is really unhelpful. So that's my assessment of it. If you don't know what to do, please start with watching the Anxiety Cure video series. If you do need some coaching to how to implement or come up with your own strategy to go loose, let go, not take it seriously, please do book in a coaching session. Don't feel you have to do it on your own. I hope that helps. If you've got any questions, please let me know, and I hope to see you again sometime very soon. Take care.